Well, it's time now for our health segment. According to a recent study conducted here in France, nearly 70% of French people could see their health deteriorate because of a lack of physical activity and the development of a sedentary lifestyle. The health agency is calling on public authorities to urgently take up the issue, which affects developed countries first and foremost. Well, to talk more about this, I'm joined by our health editor, Julia Seeger. Hi, Julia. Good to have you here in the studio. Is there a difference between a person who has a sedentary lifestyle and a person who is just physically inactive?
There is a difference between both concepts. Being physically inactive simply means, in a very straightforward manner, that you don't have enough physical activity during the day. In other words, you're not meeting the physical activity guidelines that were created by the WHO, which is about 30 minutes a day at 5 days a week. Now, being sedentary is quite different. It actually means, and it refers to the time that you're sitting down and lying down throughout the day, but long periods of time. So usually it's about 7 hours a day. So if you walk 30 minutes to work, for instance, to then spend 7 hours in front of your computer, you can be considered as active yet sedentary. So why is this a problem? Because both sedentary lifestyle and physical activity can really cause many health issues. Of course, it can increase the risk of obesity, cardiovascular diseases, as well as thrombosis. We actually spoke about this with Alicia Fillon. She's a project manager at the National Observatory of Physical Activity here in France. Let's take a listen.
We can clearly say that being sedentary has a big impact on the overall health of our population. We have statistics that can help us see it. For example, simply sitting for 3 hours a day is responsible for almost a 4% increase in deaths, all causes combined. And the risk of mortality rises significantly starting at 7 hours a day spent sitting, with an 85% increase in risk of death from cardiovascular diseases for 7 or more hours spent in front of a screen. But many of us spend 7 or more hours a day in front of a screen, especially everyone who works in an office job.
Well, Julia, this was already a problem before the coronavirus pandemic, but those lockdowns really didn't help, did they?
They didn't. It's indeed a problem, and it has been for a while. More and more people living in the northern hemisphere have developed a sedentary lifestyle because of the development of technology and the internet, for instance, and because a lot of people spend time in front of a computer while working. And COVID-19 hasn't helped at all. Many adults are now working from home, so that means that they don't even benefit from walking to the subway or to work in the morning. During lockdowns, kids have also spent much more time not being active and being in front of screens. For instance, here in France, kids and teenagers tend to spend about 4 hours a day when the official guidelines are about 2 hours a day. So it really, this COVID-19 pandemic, we're still waiting to get all of the data, but it really hasn't helped.
And according to the same study that we've been discussing, not everyone is affected the same way by the development of sedentary.
That's right. And that's perhaps the most important point is that women are much more affected by this physical inactivity and by sedentariness. So 70% of them are below all activity level guidelines compared to 42% for men. And one of the reasons why is maternity, because we don't have the same priorities. And when we do have some me time, we tend to give it to our children. Now, physical inactivity also affects more people living in cities rather than rural areas as well.
And what are some recommendations to fight against this?
Well, so of course the main recommendation is try to walk as much as possible to places. There's lots that can be done also in the workplace. Of course, we've seen standing workstations, bike desks as well. But the most important is to try to break the sedentary time throughout the day. So if you do have to spend a lot of time in front of a computer, try to stand up and walk around while calling someone, for instance. So every 1 hour, 1 hour and a half.
All right, good advice to follow. Thanks, Julia Seeger, for our health segment here on France 24.